Borrelia is the microbe we think about most with Lyme, of course.
Right.
But you were saying earlier, it's looking for food. That's the main thing. But can you go into
Right.
that a little bit more? How is it getting the food it needs?
Yeah.
How is it manipulating us? And are there other microbes that are also at play here,
Yeah. Well,
especially
there's
with the
always
arthritis?
yeah, always the possibility of other microbes. But I think what's really important to pay attention is the motive of the microbe. So when you look at some bacteria like Streptococcus pneumonia that causes pneumococcal pneumonia, it's
Right?
really aggressive. It grows really fast. It turns over. Its strategy is break down the door and do as much damage as possible. That's not Borrelia or any of the co-infections. Their strategy is persistence. They want to just hang out, get a little food, grow a little bit, and wait for multiple new opportunities to spread to other hosts. So there's some really fascinating ways that it does that. And this is where we get into what we know, which is a lot. So one of its big mechanisms for persistence is it grows very, very, very slowly. Extreme slow growth. So that makes it very resistant to antibiotics, almost completely resistant to antibiotics. It's amazing that antibiotics kill it at all because antibiotics depend on fast growth. But also that helps it be less of a target to the immune system. And what's really interesting in the current research that I've found is there aren't very many microbes. So I read an article that was comparing Lyme disease and Borrelia burgdorferi to some of the Borrelias that cause relapsing fever, which causes people to be more sick. So Borrelia, there were hardly any microbes. Relapsing fever, that Borrelia, there were a lot of microbes. There were a lot of bacteria in the person's system. So by not having many microbes, it's less of a target to the immune system. It's also fast. This is really interesting. The spirochetes are really fast. I found an article that they can outrun neutrophils pretty easily. So they can actually just run from the white blood cells. But if they
Wow.
get caught, like with some of the better ones, like macrophages do catch up with them, they can circumvent the ability of the macrophage to kill it and persist within the macrophage. So they're just sneaking right into our system, not very many of them, and they disperse to our brain, to our heart, and to our joints. And so I found studies that they were, once they penetrate the joint, they invade cells. They can invade synovial cells, the cells that line our synovial sac. They can invade chondrocytes, the cells that remodel our cartilage. They can invade fibroblasts that rebuild our ligaments. So they can invade these cells and go dormant. And I even found studies dating back to 1996 that these bacteria, Borrelia, could invade a joint, invade the synovial fluid, and if someone gets antibiotics, it kills all the active bacteria in the synovial fluid, but it doesn't kill the ones that have invaded the synovial cells. They can persist, and they can persist a very long time, and then when the antibiotics are gone, they just come right back out again. So all these mechanisms of persistence are really fascinating.